So, throughout your time in these different roles, how has the parent caregiver involvement evolved in these different settings?
When I started out as a clinical fellow, I'll say I was off the bat really passionate about caregiver involvement because I had a really amazing professor at Northwestern University, Dr. Megan Roberts. So shout out to her. She put such an emphasis on the research behind the approach to parent coaching and really how powerful it was shown to be. But I'll say when I was starting out, even though I was really passionate, I felt intimidated because I was pretty young. I went straight from undergrad to graduate school, so it felt a little challenging to go into a family's house as just like a 22-year-old with no children of my own yet and give guidance to them. And so as my clinical fellowship continued, I what I realized was I had gone to a lot of schooling to become an expert in the subject, and the expertise that I needed to combine with the expertise that they had, that the families had on their own child was what was really important. But when I went to the outpatient clinic, I would say that I'll admit it became kind of easy to become complacent about caregiver involvement because the model there was still very much kind of that pick the kid up at the lobby, go back to the therapy room, or go to the therapy gym and do your work, and then drop them back off and talk to the parent for what, maybe 3 minutes in the lobby or back in the therapy room. And I think I would have these waves of inspiration for certain kiddos, like, oh, I need to get this parent in the room with us. And I would do that for certain kiddos, but I think I noticed that I only tended to do that with cases where I felt super confident, like early language development. That was my area of, the part that I felt the most confident about. And so, in other instances, again, it still felt a little intimidating to involve parents if I was still in a place where I felt like I was skill building. And I look back on I look back on that and kind of cringe because it when I reflect, it feels like a waste, some wasted opportunities because I wasn't involving parents where I could have been. Um, and getting back into home health, I really tried to refocus on that and kind of recenter myself on caregiver involvement. And home health, I mean, obviously, is a natural place to do that. Going into their houses and having either parents, or even if it's a caregiver, if it's a nurse or a nanny, they're still with the kiddos a lot of the time, so they're valuable people to kind of be sharing resources with as well. Um, and the one spot in home health it can be tough, I know what I was doing as well was going in for daycare visits. And so that's an added challenge, trying to spend some of that indirect time keeping in touch with parents and making sure that they're still in the loop, even if you're not seeing them in person. And so now, in my role as a teletherapist, I actually really view it as a fantastic forcing function in a lot of ways because parents, in some cases, are the main facilitator of the intervention, just guided by the therapist. So with older kids who are working more independently, we're able to, share resources digitally, keep papers from getting lost in an endless pile. So similar, and then for the younger kiddos, we're doing who aren't working independently, we're doing almost entirely like a parent coaching model where they are there 100% of the time with the kiddo, not only watching you do some interaction and do some cueing and modeling, but then having to turn around and try it out themselves with your guidance and feedback. Um, so I think similar to home health, we get to take advantage of the fact that we're on their turf, and so they can feel really comfortable because we're coming to them in telepractice in their home.